Val Segura. I am one of the University of the Pacific pharmacy professors here at the pharmacy campus. I am originally from the East Bay area, and I did my undergrad at UC Davis, and then I went to pharmacy school at UOP, and then I did 2 years of postgraduate residency in Boise, Idaho.
Hi, my name is Jennifer Andres. I am a pre-pharmacy student here at University of the Pacific. I come from Fresno and I moved to Santa Rosa this summer, so technically I come from Fresno.
I think my first impression of a pharmacist was what most people think about when they think of a pharmacist, like someone that will count your pills, someone that works at at a grocery store. Maybe you don't see them as much because they're always either on the phone or counting pills. I think that's what we mostly think about when we think of a pharmacist, if you don't know much about it.
My first impression of a pharmacist would be just seeing them in like Walgreens or Rite Aid. They're doing the prescriptions, they're standing up at the counter, they're giving the prescriptions, they're like, "Hi ma'am, hi madam. What's your prescription? Here's your prescription," and they're just in the back in the counter just counting pills. That's my first impression.
There is the retail pharmacist, who is the one that most people will associate with pharmacy, and is the one that you will see when you go pick up your prescriptions, if you go to Kaiser, if you go to CVS or any other retail setting. There's also pharmacists that are more specialized, that could work in hospitals. There are pharmacists that work in clinics, AmCare pharmacists. So there's a lot of different settings for pharmacists to work at. Ultimately, they should all be looking at medication therapy to make sure that we're giving the most appropriate medications or recommending the most appropriate medications to our patients. Depending on where they work and the kind of training they had, they could do more than that. Some have the ability to actually be furnishing medications, which is what we call, the same thing kind of as prescribing medications, but we say furnishing medications for pharmacists. Or if they work in community settings, they are the ones that are checking the filling of prescriptions as well. So we are trained very differently. So ultimately, we should know how medications work and the conditions that a patient may have and what we use to treat that. But we are, as pharmacists, we're not trained to being able to diagnose if somebody has different problems. We can't tell them, "Oh, you have this or that," because that's just not in our training. Same way, physicians are not necessarily the drug experts. They're definitely the experts at diagnosing patients, but when it comes to medication therapy, we have pharmacists for that, or we are pharmacists for that. So we are another second check whenever there's a prescription coming up for a patient to make sure that it is the right dosage, that it is used being appropriately, that there are no drug interactions. And pharmacists in ambulatory care, they actually are able to take care of patients for chronic conditions, because physicians a lot of the times are overloaded with patient cases that they have to take care of. So they may not necessarily have as much time to dedicate to all of the patients for chronic conditions versus some of the more challenging and specialized cases. So a pharmacy technician, generally will do less than a year of training in order to get their pharmacy tech education. But as a pharmacist, it is a doctorate level degree, so we do go to school for quite a long time. Pharmacists are the ones that should be checking, doing the clinical decisions for patient care, versus technicians, given their training, they're not allowed to provide any recommendations to patients because it's just not something that they are trained to do. But they're definitely fundamental in the pharmacy setting, because they help pharmacists a lot when it comes to filling and delivering of medications. Pharmacists are important because we use medications to treat pretty much everything. When somebody has a problem, we're going to be giving medications, and we need someone that is trained to really understand how medications work and what the best therapy for a patient happens to be. And we are part of the healthcare team, and we are fundamental in making sure that we are providing the best care that we can for our patients.
One of the reasons why I chose this major was because of my experience in, in dealing supplements. That sounds weird, but counting supplements like vitamin B, vitamin D, I think magnesium, or I think lutein for the eyes, just for my family, because my siblings couldn't do it themselves. So I was tasked with putting it out for them. And another reason was because my sister, she has type 1 diabetes, and so she has to do insulin, she has to do her blood pressure medicine. And I figured, hey, if there's a way I could make it streamline that process for her and make it easier for her, then why not go to pharmacy school to learn how to do that?